You know that feeling when you're in the middle of something important, a meeting, a movie, a conversation, and suddenly your bladder sends an urgent message that cannot wait? Or maybe you're mapping out every bathroom location before you leave the house, just in case. If this sounds familiar, you're not alone, and I want you to know something. You don't have to live this way. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your urological health, stay with us. We're here to help you understand your body with clarity and comfort. Today, we're going to talk about overactive bladder, what it really is, why it happens, and most importantly, 11 practical ways you can take control back. And if you're new here, welcome. I create content every week about bladder health, sexual wellness, and urologic care that actually makes sense. Make sure to subscribe and share this channel with anyone who might benefit from straightforward, compassionate medical guidance. So let's start with the basics. What exactly is overactive bladder? Overactive bladder isn't just about going to the bathroom more often. It's a collection of symptoms that, together, can seriously disrupt your daily life. There are 4 main signs we look for. First, there's frequency. This means you're going to the bathroom more than 8 times in a 24-hour period. Now, if you're drinking extra water or having more fluids than usual, of course you'll go more often. But when the frequency starts interfering with your day, when you can't focus, can't finish tasks, can't enjoy activities, that's when we need to pay attention. Second is urgency. This is that sudden, intense need to urinate that feels impossible to delay. It's not a gentle reminder, it's a demand. And sometimes, urgency comes with accidents, which we call urgency urinary incontinence. That's when the urge is so strong that you leak before you can make it to the bathroom. Third, there's nocturia, which means waking up more than once during the night to urinate. Sleep is precious, and when your bladder keeps interrupting it, your whole body suffers. And fourth, some people experience leakage or loss of bladder control, which can happen suddenly and without much warning. When these symptoms happen together, and when they start affecting how you live, we call it overactive bladder. But here's what I want you to understand. This isn't just about inconvenience. It's about quality of life. People with overactive bladder often tell me they've stopped going to social events. They avoid movies, road trips, or even visiting friends because they're worried about finding a bathroom in time. Some plan their entire day around restroom locations. Others feel isolated, embarrassed, or anxious about being in public. It can affect your work. Imagine trying to focus on a project when you're running to the bathroom every hour. It can strain relationships, especially intimate ones, because the fear of leakage during sex can make people pull away from closeness. And financially, the cost of pads, protective underwear, extra laundry, and replacing bedding adds up quickly. Studies show that about 16% of people experience symptoms of overactive bladder. That's a significant portion of the population, and yet so many suffer in silence because they think it's just part of aging or something they have to accept. I'm here to tell you, you don't. Now let's talk about why overactive bladder happens, because understanding the cause is the first step toward finding relief. Age is a common factor. As we get older, changes in the bladder muscle and the signals between the bladder and brain can lead to these symptoms. But let me be clear, just because something happens with age doesn't mean it's normal or that you should ignore it. Weight plays a role too. Research shows that people who are overweight or obese are significantly more likely to experience urinary incontinence. In fact, women with obesity have about 3 times the risk of leakage compared to women at a healthy weight. The extra pressure on the bladder and pelvic floor can weaken the structures that help you maintain control. For women, pregnancy and childbirth can contribute. Multiple vaginal deliveries, in particular, can stretch or weaken the pelvic floor muscles and nerves, which can lead to bladder control issues later in life. Medical conditions are another major cause. Diabetes, for example, can damage nerves that control the bladder. Depression and anxiety can affect how your brain communicates with your bladder. Neurological conditions like multiple sclerosis, Parkinson's disease, spinal cord injuries, or a history of stroke can all disrupt normal bladder function. Previous surgeries matter too. If you've had a hysterectomy, pelvic surgery, or radiation treatment in that area, those can change the anatomy or nerve pathways involved in bladder control. Even surgeries meant to help with one type of incontinence, like a mid-urethral sling for stress incontinence, can sometimes cause obstruction or blockage of the urethra, which can worsen overactive bladder symptoms. Recurrent urinary tract infections can irritate the bladder lining and trigger urgency and frequency. And certain medications, especially diuretics or water pills for high blood pressure or swelling, can make symptoms much worse by forcing your kidneys to produce more urine more quickly. So you see, overactive bladder isn't just one thing, it's often a combination of factors, and that's why treatment needs to be personalized. When you come to see a urologist for overactive bladder, we start with a conversation. We'll ask you about your symptoms, when they started, how often they happen, what makes them better or worse. We'll want to know about your medical history, any surgeries, medications you're taking, and how these symptoms are affecting your life. Then we do a physical exam. For women, we'll check for things like cysts or growths around the urethra that might be contributing to the problem. For men, we'll do a prostate exam because an enlarged prostate is a very common cause of overactive bladder symptoms in men. We'll also test your urine to rule out infections or blood, which could signal other issues that need attention. And we'll do what's called a bladder scan or post-void residual. This is a simple, painless ultrasound that measures how much urine is left in your bladder after you urinate. If you're not emptying completely, that leftover urine can cause urgency, frequency, and leakage. All of this helps us understand what's going on and create a treatment plan that's right for you. Now let's get to what you came here for, the solutions. Here are 11 evidence-based ways to manage and improve overactive bladder symptoms. 1. Lose weight if needed. If you're carrying extra weight, losing even a small amount can make a big difference. Studies show that losing just 8% of your body weight, so if you weigh 200 pounds, that's about 16 pounds, can significantly reduce urinary symptoms. The relief on your pelvic floor and bladder is real and measurable. 2. Avoid bladder irritants. Certain foods and drinks can irritate your bladder lining and make symptoms worse. The main culprits are caffeine, alcohol, carbonated beverages, artificial sweeteners, spicy foods, and acidic foods like citrus or tomatoes. But here's my advice. Don't eliminate everything at once. Pick one thing, cut it out for a few days, and see how you feel. If it doesn't help, bring it back and try eliminating something else. You don't need to make your life miserable. Just figure out what your bladder is sensitive to. 3. Drink the right amount of fluids. This might surprise you, but both drinking too much and drinking too little can worsen overactive bladder. If you drink too much, your bladder fills up faster and you have to go more often. If you drink too little, your urine becomes concentrated, which irritates the bladder lining. My recommendation, drink normally with your meals, breakfast, lunch, and dinner, and then sip water throughout the day. Don't chug large amounts all at once. And remember, if you're eating fruits, vegetables, soups, and smoothies, you're getting fluid from those too. Listen to your body. If you're thirsty, drink, but don't force excessive amounts of water. 4. Manage constipation. Your rectum sits right behind your bladder. When your bowels are backed up, that full rectum pushes against your bladder, leaving less room for urine and making urgency and frequency worse. Keeping your bowels moving regularly, through fiber, hydration, and sometimes gentle stool softeners, can really help your bladder symptoms. 5. Quit smoking. Smoking doesn't just harm your lungs, it irritates your bladder and is a major risk factor for bladder cancer. If you smoke and you have overactive bladder, quitting is one of the most important things you can do for your urological health. 6. See a pelvic floor physical therapist. Pelvic floor physical therapy isn't just for people with weak muscles. A skilled therapist can teach you exercises to retrain your bladder, strengthen the right muscles, and relax muscles that might be too tight. They can also help you learn urge suppression techniques, ways to calm that urgent signal and give yourself time to get to the bathroom calmly instead of rushing. Here's how it works. When you feel that intense urge, instead of running to the bathroom immediately, pause. Do a few quick Kegel exercises. Distract yourself. The urge will peak and then fade, like a wave. Once it passes, you can walk to the bathroom with control. But before you start any pelvic floor exercises, please see a urologist or physical therapist to make sure you don't have a high-tone pelvic floor, which would require a different approach. 7. Try behavioral therapy and bladder training. This is about retraining your bladder to hold urine longer and respond to signals more appropriately. It involves scheduled bathroom trips, gradually increasing the time between trips, and learning to suppress urgency. It takes patience, but it works. 8. Consider medications. If lifestyle changes aren't enough, there are medications that can help. Some relax the bladder muscle so it doesn't contract as forcefully. Others help the bladder hold more urine before signaling the need to go. These medications aren't perfect. They can have side effects like dry mouth or constipation, but for many people, they provide significant relief. Talk to your urologist about whether medication might be right for you. 9. Explore bladder Botox. Yes, Botox isn't just for wrinkles. When injected into the bladder wall, Botox relaxes the bladder muscle and reduces those sudden, strong contractions. The effects last about 6 to 9 months, so it does need to be repeated, but it's about 80% effective in reducing symptoms. It's a simple outpatient procedure that can make a huge difference. 10. Look into a bladder pacemaker, sacral neuromodulation. This is a small device implanted under the skin that sends gentle electrical signals to the nerves controlling the bladder. Think of it like a pacemaker for your bladder. It's about 80% effective and can dramatically reduce urgency, frequency, and leakage. It's a more involved procedure, but for people who haven't responded to other treatments, it can be life-changing. 11. Try percutaneous tibial nerve stimulation, PTNS. This is a bit like acupuncture for your bladder. A small needle is placed near the ankle, stimulating the posterior tibial nerve, which connects to the nerves that control the bladder. You come in for 30-minute sessions once a week for 12 weeks, then once a month for maintenance. It's about 60 to 70% effective and completely non-invasive. There's also a newer implantable version that stimulates the nerve automatically at home, showing similar results with less frequent office visits. So there you have it. 11 real, evidence-based ways to manage overactive bladder. Some are simple changes you can start today. Others require working with a specialist. But the most important thing I want you to take away from this is that you have options. You don't have to live in fear of your bladder. You don't have to plan your life around bathrooms. You don't have to suffer in silence. Overactive bladder is common, it's treatable, and there are many tools we can use to help you regain control and confidence. If you're struggling with these symptoms, please reach out to a urologist. We're here to listen, to understand, and to help you find the solution that works for your life. And remember, taking care of your bladder is taking care of yourself. You deserve to feel comfortable in your own body, to enjoy your life without constant interruption, and to know that help is available. As always, take care of yourself, because you're worth it.